Hello everyone, my name is Alimata Ouedrao, and I'm presenting to you today my project about increasing early screening of depressive disorder among adolescents. I would like to use this opportunity to thank my committee members, my chair, Dr. Lisa Stuber, my second reader, Ms. Abibola Aliou, and my community member, Mr. Ernest Okwabo. Background and significance. Depression in adolescents is a significant public health concern because of its adverse health outcomes. Depressive disorder is a major risk factor for suicide, which is the third leading cause of death in this age group. Besides, more than half of adolescents who commit suicide are reported to be afflicted with depression at the time of death. Apart from suicide, depression results in significant social and functional impairment. Therefore, improved screening and diagnosis are core in early management and improved health outcomes. Major depressive disorder results in functional impairment among adolescents, including poor school performance and interpersonal problems. Additionally, depression results in development of other mental health, risk for suicidal thought, suicidal attempt, and suicidal completion. Approximately 8% of young adults diagnosed with depression as adolescents commit suicide. The United States Preventive Services Task Force recommends screening for major depressive disorder in adolescents aged 12 to 18 years. Implementing screening in addition with proper system has the potential of increasing accurate diagnosis, effective treatment, management, and follow-up for depression. There are several screening tools which can be used in screening the depressive disorder. Patient Health Questionnaire modified for adolescent PHQ-9 is effective for screening of depression among adolescents. The purpose of this quantitative improvement project was to determine if timely screening of depressive disorder among adolescents using the Patient Health Questionnaire modified for adolescents PHQ-9 increases identification, diagnosis, and management of depression for an improved outcome. The literature review. Initial search through Channel Plus with full text using the keyword adolescent depression yields over 3,000 sources of data. Refinement to only include full research articles written in English within the last 10 years since 2011 yield over 1,300 articles. Further refinement using the word "and" screening yield only 109 articles which were critically analyzed, and the most appropriate were selected. Another database that was used to research information about this project was the PubMed, and the word adolescent as a search term yielded millions of research articles. Refinement using the term adolescent depression, full text English language, and not older than 10 years since 2011 yield over 30,000 sources. Free full text and screening, randomized control trial, and systematic review refinement resulted in 531 sources from where the most relevant ones were selected to complete this project. And according to researchers, depression is a debilitating mental health disorder that results in suboptimal physical health and significant impairment in many areas of life. Social interaction with peers and family members are impaired as adolescents diagnosed with depression isolate themselves and spend less time with others. Lack of concentration at school results in significant drop in performance. Poor performance predict low socioeconomic status later in life. Adolescents with depressive disorder, and depressive episode are more likely to drop out of school and suffer unemployment. Researchers also found early pregnancy and parenthood heightened risk for suicidal ideation, attempt and completion, and abuse of alcohol and other substances to be the consequence of depression among adolescents. According to multiple researchers, suicide is the third leading cause of mortality among older adolescents. In several research studies, they also concluded that diagnosis of depression predisposes adolescents to development of major depressive disorder and other mental health disorders such as anxiety disorder and eating disorder in adulthood. Depressive disorder results in morbidity and mortality and significantly impair the quality of life of adolescents. Several research studies conducted that screening results in early detection of depressive disorder, and once detected, treatment modalities are put in place resulting in improved depression severity and health outcome. Therefore, screening is an important step toward increased diagnosis and detection of major depressive disorder among adolescents. Screening improves depression management as it helps identify individuals who have depression but have not started treatment or have not been diagnosed. Screening is supposed to identify symptomatic conditions that will not be reported. Theoretical framework. The Kurt-Lewis theory was the framework that was used in this project. Kurt-Lewis theory lays out a plan of change and identifies driving and restraining forces which influence implementation of change. According to the theory, individuals within an organization are influenced by two important factors: restraining forces that counter process aimed at maintaining status quo, and driving forces that propel change forward. And a constant antagonism between the driving forces and the restraining forces maintains equilibrium within an organization. To implement change effectively, the change agent should use Lewin's three-step model to change the status quo, which is unfreezing, moving, and refreezing. Those steps are the three steps used to influence change in this project. During the unfreezing stage, it entails creating awareness about the problem and challenging the status quo. As the change agent were created, we created urgency for change through information and fact. Healthcare providers Nurses, to be specific, were educated on the need for change. The status quo of inconsistent screening of adolescents was challenged. Information about the adverse outcome of late diagnosis of depression was presented, creating urgency for change. In the moving stage, the factors which could have derailed the change were identified and addressed through strategies such as brainstorming, coaching, and training. The change was implemented. The PHQ-9, which was the screening tool, was the instrument used to screen adolescents who came into the healthcare facility. Benefits of timely and consistent screening were spelled out as nurses were being coached and trained on screening using the PHQ-9. In the final step, refreezing, new equilibrium was integrated to make the change a habit by monitoring key performance indicators, such as the rate of screening and the number of adolescents treated, and the success were celebrated. The aim of the project is to make early screening of adolescents for depression a standard operating procedure. Methods and design used in this study. The study was a quality improvement project seeking to increase screening for adolescent depressive disorder using the PHQ-9 screening tool. It employed a quantitative design where data was collected through a retrospective chart audit and recorded in the data collection sheet. Retrospective chart review entails the use of pre-recorded patient data to answer certain research questions and does not require participation of the patients. An evaluation and an educational intervention about the importance of adolescent depression screening using the PHQ-9, which is a modified PHQ-9 screening for depression, was used, and recording of the result of the electronic medical record system was completed after the initial chart audit. Nurses were further educated about depression in adolescents, management, and referral after positive score on the PHQ-9. Pre- and post-intervention retrospective chart audit was conducted to address the goal of the project. The data was compared to determine if the educational intervention increased the screening rate of depression among adolescents. The sample size. The data for this project was extracted from medical record of adolescents aged between 12 to 18 years in a community healthcare facility in the northeastern part of the United States. The data was collected before and after the intervention, which was an educational intervention on how to screen for depression among adolescents. There was no direct involvement of the adolescents in the project. 150 patient medical record met the inclusion criteria. For the data analysis, a retrospective chart audit before and after implementation of an educational intervention were utilized for data collection. A data collection sheet was used to record minimum necessary pre- and post-intervention data. Descriptive statistic was employed to describe frequency of screening before and after the educational intervention. Descriptive statistic was used to give summary about the sample and the study without making any inferences. And the results are the following. The objective was to assess the difference between these two sample groups, thereby affirming the impact of the intervention. A z-test was undertaken and the z-value was 2.66 with a z-score of 1.96. Clearly, the z-value of 2.66 is greater than the z-score of 1.96. Therefore, the null hypothesis was rejected in favor of the alternate hypothesis, and conclusion that the difference between the pre- and post-intervention group is significant. The main conclusion is that the training intervention was effective in promoting differences in the management of the mental health of the sample teenagers group. The limitations that we face while conducting the project. The intervention involved educating the medical professional on conducting a comprehensive analysis of students to determine the potential for concealed mental health issues. This approach was intended to enhance the capacity to identify learners who needed additional psychiatric care to mitigate adverse psychological conditions such as depression. The main issue with this approach is that varying clinical experience of the sample medical practitioners who were part of the project may feature as sources of bias, especially knowledge acquisition and the quality of application of concept taught may be higher among the much more experienced practitioners than relatively newer ones. First, the differences in the application of the concept may introduce bias in the study. The study overall design may be a source of bias, pointing to the differences in the professional experience among the sample healthcare workers included in the study. In discussion, the present study finding confirmed the positive effect of the educational intervention on the quality of mental care offered to adolescents. The objective of the analysis was to affirm the statistical differences between the pre- and post-intervention group, which the data confirmed. This outcome revealed that the intervention effectively improved the quality of mental health care offered to the target group. Several research studies concluded that improved educational training enhances the competence of medical practitioners in enhancing their ability to detect and provide comprehensive mental health care to patients. This finding aligned with the conclusion of other previous studies, thereby affirming their reliability. A study by Gaderberg in 2017 arrived at a similar finding in exploring the value of early screening in improving the management of client psychological needs. Both these studies affirm the overall reliability of the present research findings. This similarity provides additional justification for the overall generalization of the findings. The use of quantitative data and the sampling strategy features are the present study's primary strength. The adopted methodology enabled the study to have statistical support for the conclusion and inferences made. Such an advantage would not have been possible when using qualitative approach. Additionally, the suitability of the sample used for the data analysis was an added advantage because of its alignment with the research goal. Specifically, the responder or participant were all adolescents who were in learning situations. Therefore, the findings can be generalized to the target population, which are the adolescents. Implications for practice. The study findings have significant implications for future research, healthcare policies, and quality measures. The result revealed the importance of refining the current counseling program implemented by learning institutions. For instance, the findings justify increased investment in this program to expand their service delivery capacity. An ideal investment would involve increasing the staffing level and providing additional training to boost the capacity of school counselors, nurses, providers, program. The study justified the need for implementing measures to facilitate early screening of depressive symptoms for adolescents, given the implication on their overall mental health. The findings reveal that this intervention enhances access to quality medical care, thereby elevating mental health well-being. The next step should be to empower school counselors, nurses, even teachers to implement the intervention. This outcome can be achieved through financial and educational intervention, thereby enabling them to amplify their capacity to identify mental health needs of the local student population. The subsequent follow-up intervention will improve psychological health of the student. Therefore, the findings rationalize increased investment in school therapy sessions and implementing additional student monitoring measures. This is the end of my presentation, and the references listed have been utilized in this presentation and toward the completion of this project. Thank you for listening, and I would like to use this opportunity to open up to questions pertaining to this scholarly project. So please feel free to ask any question or provide any comments. Thank you. And I would also like to thank the institution, the facility who made this possible for us to conduct this project. Thank you so much.